Uh, First, Assalamu alaikum and Jazakallahu khairan ajma'in for all of you for coming on. My name is Hassan Shanwani, and for the last year, I've been the president of AMHP. And we want to take a few minutes to tell you a little bit about some of the outstanding work. You'll be seeing, inshallah, a short video of some of the work that we've been doing over the last few years. And then you'll be seeing you'll be hearing from two of our board members, Dr. Sana Sayed, who's a practicing physician, and Dr. Rukhsana Muna Chowdhury, a psychologist, about some of the outstanding work that we've been doing in advocacy, mental health, and so many other things. I will tell you personally, I've been involved with AMP from its founding 16 years ago until today. And mashallah, the organization has really grown from a small group of students that were trying to, with an interest in public health at a hotel at an ISNA conference, leading to this really important national organization that we are. As recently as a couple of days ago, we met with the Department of Health and Human Services, and we're setting up an interview with the Surgeon General, with a prominent imam from the Muslim community to talk to Muslims about COVID vaccination. The National Muslim Task Force has been working with the CDC and really working with, we started as four national organizations, us, Islamic Medical Association of North America, the Fiqh Council, ISNA, and it grew very quickly because everyone recognized 40 national Muslim organizations across the country, all speaking to Muslims because of the importance of the public health pandemic. And inshallah, very soon, we're even going to be building content for COVID vaccines in Arabic and Urdu to speak to immigrant communities that are predominantly Muslim. And inshallah, starting in 2021 at Martin Luther King weekend, we'll be starting an ongoing series about racism as a public health crisis with our partners in the National Black Muslim Task Force for COVID relief, and some leaders in Islamic Relief, Muslim Wellness, and other leaders in the African American community. AMP is doing some, mashallah, incredible work. We're hoping that you can hear some about it today and that we can convince you of the quality and importance of the work. And let me be the first to ask you, we can't do this without support from people like you. So as you listen, please consider how you can help us deliver this important work to American Muslims, the American community, health professionals, and help AMP be the leading organization that it is and will continue to be, bi'Iznillah, in 2021. With that, we're going to start with a small video, and then I'll turn it over to the panel. Jazakallah khair.
The American Muslim Health Professionals was created with the intent of bridging the tenets of Islam with key public health issues facing our communities. Over the past 15 years, AMP has provided outlets for Muslims in the healthcare sector to network and collaborate on issues that operationalize their faith by serving the community.
The idea behind AMP was simply to create a platform for Muslims who are working in diverse sectors of healthcare for professional development reasons, but more importantly, how can we come together to leverage our skill set, our educational background, and our expertise to work on public health initiatives for society.
We strive to assist healthcare professionals and students to excel in their chosen career paths by providing opportunities for networking, information sharing, and leadership building. We convene numerous sold-out networking events in various cities across the country. AMP's recent National Public Health Conference was held at the top medical school in the world, Harvard Medical School, in collaboration with Harvard School of Public Health. The conference provides attendees access to highly accomplished public health pioneers, entrepreneurs, and healthcare leaders.
And in all of our endeavors, we seek diversity in all its multiple forms. And to promote equity and social justice in our community,
AMP launched a membership campaign, which includes the first ever comprehensive national directory of Muslim health professionals and students. At AMP, we believe everyone has a right to health care, and our work and efforts exemplify that belief. AMP developed policy briefs and engaged congressional representatives on the critical role of Muslim-free clinics and the importance of comprehensive health reform. We launched national interfaith and national Muslim enrollment campaigns to raise awareness and ensure individuals are connected to healthcare coverage. In partnership with 80 organizations, we reached over 300,000 individuals in providing information about the Affordable Care Act. With efforts seeking to undermine and repeal the ACA, our members joined interfaith campaigns, vigils, and protests throughout the country to advocate for the uninsured and underinsured. AMP developed Healthcare Advocacy Toolkit and an Advocacy Chuppah Guide so individuals can use as a resource to protect everyone's equal access to healthcare. Through our mental health programs and initiatives, our mission is to destigmatize mental illness and improve mental health literacy. We've held national webinars with the Substance Abuse and Mental Health Services Administration and conducted Muslim youth identity panel discussions focusing on the impact of discrimination on a young person's well-being in a climate of prejudice and Islamophobia. AMP organized the first ever National Interfaith Anti-Bullying Summit at George Washington University to share research and best practices about an increasingly serious problem facing youth of various religious backgrounds, and published a report with the Institute for Social Policy and Understanding. Our mental health first aid certification trainings, an evidence-based program which introduces participants to risk factors and warning signs of mental health problems, are being conducted throughout the nation.
It leaves you with something like tangible that you could actually implement. This prepares you because it leaves you with actual things to say to them.
Over the years, AMP has received some of the highest honors, such as the White House Champion of Change Award, and was one of the 8 faith-based organizations to join former First Lady Michelle Obama's Let's Move initiative. AMP was invited to a private roundtable between a diverse cross-section of American Muslims and former President Barack Obama. With your support, we plan to build resources for Muslim-run free clinics across the country to treat uninsured patients and expand our advocacy program in Washington, D.C. and other cities. We intend to meet the growing demand for mental health first aid training, which provides an infrastructure for communities to identify and respond to mental health crisis, trauma, and substance abuse issues. AMP is growing and establishing chapters in different cities to continue our impact at the grassroots level. Muslims are mandated by their faith to look after one another's well-being and address the needs of the underserved, and this is AMP's mission. It is what drives our members to do the work they do to advance public health, social justice, and civic engagement within our communities.
And I thought about my 3-year-old son, that he would say, "But what else did you do? What did you do to change other people's minds? What did you do to fight what you saw when you saw all these communities suffering and not just ours?"
What you're seeing here is some of that content of the many organizations that were working. And with that, let me turn it over to, I think Dr. Chowdhury is next. Yes, Mona?
Yes, thank you. Thank you, Hassan. Thank you, everyone, for welcoming me to your Sunday afternoon here. I want to touch a little bit about, what's sort of my passion in mental health and how that started. And, for many years, I worked with young kids and adolescents, and at the beginning of my career as a clinical psychologist. And I found that oftentimes mental health is the least spoken about issue in families and communities. And a lot of kids grow up, I think, even in the Muslim community and other communities, sort of not addressing that underlying experience that they struggle with. And then that leads into adulthood, where a lot of silence and shame and stigma comes along with that. And, ultimately, as we work through different mental health programming at AMP, I found that this translated to many communities, and we have an opportunity to reduce shame, stigma, and discrimination of mental illness and mental health issues, I think nationally. And so when I look back at the work I've done with young kids and adolescents, I know that the work we do now will essentially help them develop into more fully fleshed, whole human beings. And that really helps me to feel grounded in my passion about mental health. And I have had a number of stories that I've heard over the years where people have gotten the treatment early, where families have accepted the experience of mental health or mental illness in their family and have been changed by it. So that really drives me. I want to just point out some of the work we've done at AMP in terms of education and outreach. We've done a number of presentations on various topics that include anti-bullying, along with culturally appropriate care. Some of the institutions we've partnered with to do these webinars and conferences are Harvard Medical School, Stanford University, the Institute for Muslim Mental Health, and MIT. So we really feel as though the work we're doing in education has helped us get the word out on the connection between shame and stigma and adult development and family health and well-being. And we continue to do that work. Next slide. We've also talked about the work we've done with youth, and ultimately this has started with anti-bullying and has moved on to issues of addiction, depression, anxiety, and how we can kind of bring people into the fold of understanding and recognizing this in their own families. One of the issues that we have targeted and discussed is suicide. Recently, suicide has become known and has been pointed out to be one of the leading causes of death amongst young people in the United States. And we recently covered this due to a suicide that occurred in the Chicago area, and it received national attention on Facebook. And this work is so important in how we address suicide in the American Muslim community, and hopefully can help others learn how to have that discussion, because when we have those discussions, such as in our own community, hopefully other communities can also begin to have it. And this is how we start the process of reducing stigma. I want to just point to a last and final piece here to my presentation, which is a really critical piece of work we've done in the last few years on mental health first aid. This is a nationally recognized program on learning the language of literacy around mental health. People all around are learning how to have the discussion, but sometimes don't have those words and don't feel that they have the license to even have the conversation amongst their families and their communities and their friend groups. And we want to change that, which is why we partnered with the mental health first aid movement. The National Council of Behavioral Health developed this program. We took this program and we've spread it by having, events across the country with over 10 cities being targeted for these events. We have reached over 700 people to be certified, but even from there, we really have to think about the impact being much larger, because those people take this program, take that language, and use their curriculum in their communities to start breaking down the barriers of discussion and having people learn about the possibility that mental health is not, and mental health issues are not just this area that we have to continue to silence, but that we can bring into the notion of our overall well-being, and every individual can begin to look at that within themselves, and then hopefully, broaden that to beyond who they are and to the people that they interact with on a daily basis. So that's why we feel the outreach has been so much more than even the numbers we can track. And again, this has been over 16 states as well. And so I really wanted to go over the basic pieces of what we've been doing. I'm happy to take questions in the end of this presentation about this work, and I appreciate your time.
Thank you, Mana. So I will take it from here to talk about health policy and advocacy. To start off, just to introduce myself, my name is Sana Sayed. I'm a neurologist in Boston, In addition to seeing patients, I work full-time as a senior medical director at a pharmaceutical company doing drug development research. And to balance out all my interests, I'm also on the Health Policy and Advocacy Director for American Muslim Health Professionals on their board. And I'm going to speak a little bit about what I do in that role. But just to tell you, relative to the others, I joined AMHP in the last 3 years or so. And the reason I joined was after going to an event where the upcoming Surgeon General, Dr. Vivek Murthy was there, and so was the CEO for Medtronic, Dr. Umar Sharak. And what that showed to me was that this organization was really, truly working for the benefit of all Americans, and it's true to their mission statement, essentially. And it's not just by engaging broadly and being a part of the mainstream public health efforts that we need to be, by the way. There is no separate public health effort for Muslims. The public health is for everybody, right? But they also engaged across industries. That is something that is so important in public health in general. So that really spoke to me. I was inspired to join, and I did. And I've been with them since. And let me tell you a little bit more about what I have been doing over that time. If we could go to the next slide, please. So to set the stage for you guys to understand the health policy program, just to go over our priorities to begin with. And the way that we've come up with these priorities is based on what is needed in the society, right? You have health policy, and it has to address the problem that exists. And for that reason, obviously, we've been working nonstop on COVID-related health policy issues since all of this started, really from the inception, as part of the National Muslim Task Force that Hassan mentioned, and in individually as well, where these needs arise. And a lot of our work has been centered on solutions for the pandemic, like increasing testing, increasing PPE for our health workers. And I'm not going to go through all of it, but basically that has been kind of our core focus very recently. But of course, we've been working on many issues prior to the pandemic. And what happened during this recent period is that a lot of these problems were amplified. So healthcare access, always a problem. In the pandemic, a massive problem, right? So now we've continued our efforts on Medicare and Medicaid expansion. We've worked historically in the Affordable Care Act that you saw in the video. That has continued. We also see housing and food insecurity as public health issues, and we've worked on that as well. So that's kind of the gist of what we've been working on. And I'll be speaking about the health equity effort later. And how have we done that? So the way that we've addressed this problem is by obviously being very bipartisan. Healthcare is everybody's problem. It's not according to your vote. So we've engaged broadly with senators, with congressional leaders, federal leaders, and we've advocated for the policies that I mentioned before, through letters, through meetings. And these meetings are worth mentioning because what we did essentially was we understood that civic engagement is extremely important to get the message across. And we have broad outreach to health professionals. And as a result, what we did was we also recognized that there was a gap in training for advocacy for health professionals in general. So we conducted several trainings. We also managed to set up meetings with Senate offices and the sort of the representatives and the constituents that lived in those senates to meet the health professionals that were constituents in a particular state, met with their representatives in the Senate to discuss the problems on the ground and talk about tangible solutions. And we did all of this in a very collaborative fashion. I'll speak to that later, but we obviously work with a lot of advocacy, healthcare, public health organizations. And if you could go to the next slide, please. So this is the health equity effort. Obviously, we were inspired to engage in health equity also because most of you would know that healthcare disparities is an ongoing issue in this country. What the pandemic made us realize that it was bigger than we thought, and it had been brewing in the background, and now it's front and center. So as a matter of social responsibility, obviously, and just because this is a part of the public health crisis, we really needed to engage on this matter. And the way that we decided to approach it is, again, we did it a very collaborative effort. The collaborations we had are with the organizations listed on the right. Equal Health Campaign Against Racism is a part of Equal Health. That's the organization we're working with. We are essentially looking at adjusting the healthcare practice in a judicious way by looking at how race is incorporated in clinical care. And what we're trying, the way we're approaching it is by emphasizing public health education and also exploring the science behind the use of race. And we're trying to message our work by publications and whatnot. So where I'm gonna sort of leave off for Urshia is that the partnerships. Well, basically, we're not gonna go into the details of who we've partnered with, but as you can see, we've partnered with various healthcare, public health advocacy organizations across the board in order to make sure that, that our work gets done. And with that, I'll hand it to Urshia.
Thank you, Sana. My name is Arshia Wajid. I am the founder and board member of AMP. I want to thank everyone for joining us today. I work as a healthcare executive for one of the health systems in Chicago. For our Muslim-free clinics, one of our core principles for the work that we do under health policy and advocacy is focused on minority and underserved communities. In 2018, Dr. Lance Laird and Nabil Khan from Harvard and Boston University did a comprehensive research study on the impact that Muslim-free clinics have. And the study is available on our website. And one of the key takeaways was the financial impact of Muslim-free clinics across the country in providing medical services to uninsured patients of all backgrounds. We also just released another survey last month to gauge the needs and build resources for those clinics. And we're working on publishing an updated to the study itself. The other thing I'm going to mention is also we're conducting screenings of a documentary called Unconditional Care, How Muslims Are Closing the Healthcare Gap. It is a 30-minute powerful story of a software engineer who grew up in the slums of Bangladesh and immigrates to the United States. And he decides to give back, and he does so by building a free clinic in Jacksonville, Florida, where over 100,000 adults are uninsured. And what's noteworthy is that the producers, Matt Colacello, who made the documentary, did so in memory of his 23-year-old friend, Teleshin Meshe. And Teleshin was stabbed to death on a commuter train in Portland, Oregon. And this is when he was trying to stop the harassment of two Muslim women. This incident happened in 2017. And Matt's ultimate goal was really to counter the negative portrayal of Muslims by changing the narrative in the media and showcasing their contributions to society. Next slide. Next. So now that we've reviewed our accomplishments, I wanted to spend some time to share what we need your support for today and how much it even costs to operate some of these programs. As you can see from the graph, nearly 70% of our funding are really towards our core focus areas. And on the right-hand side, it has a breakdown of how that funds are used within those programs. In advocacy, so we really are the only national Muslim organization with a core focus on health policy and advocacy. And our plan with your support is to conduct more congressional trainings for health professionals so that they can be equipped to better advocate with their elected officials, increase screenings of the documentary, build out programming for health equity, and then also build resources for Muslim-free clinics. And with our mental health program, we want to increase mental health literacy. So the National Council of Behavioral Health, they want every American certified in mental health first aid. teachers, parents, community leaders, frontline workers. And now that we're doing this virtually, we're able to expand it into more communities. Recently, we just had a call with Muslim Youth of North America, MSA National, and Young Muslims. And one of the organizations did a survey. Out of 120 students surveyed, 91 said mental health should be a top priority on their campuses. And this is coming from students themselves. And so we're actually working with them on a phase 1 to train student leaders and expand to all other students as part of phase 2. And right now we have 9 certified instructors, but in order to continue to expand the program, we want to, of course, ensure and certify more instructors. And really, in conclusion, I just want to say that AMP is really the only national organization that brings together professionals from all sectors of the healthcare industry. And our goal is really to collaborate and work on public health initiatives. And we do believe that we're filling a niche for our community and society in large. So, we do hope that you find one of the causes that we've discussed today and that resonates with you, and that you support it at the level that you're most comfortable with. We're just going to close with a 2-minute testimonial from one of our donors, Dilnaz.
Assalamu alaikum. I come to you today as a donor for American Muslim Health Professional. One of the reasons our family so actively gives to AMHP is their efforts to educate and call to action about mental health first aid, with interfaith trainings, raising awareness to mental health literacy, and collaborations with many other organizations that also are mission-driven for social impact on mental health. So use your agency and let's all understand about our Muslim communities that are struggling with mental health and how we can educate parents, children, community leaders, and professionals to support our individuals dealing with mental illness. AMHP has urgency for all Muslim communities to remove the stigma of mental health, drug use, and suicide. We have to take our agency and make sure that we own this topic with data collection, preventive steps, and community efforts. So if you can reimagine the possibility where children, women, immigrants, refugees, and our interfaith partners can work together to understand about mental health, this is the time. This work needs funding to be done well. Centering the Muslim voice is so imperative right now, and telling our own stories is really difficult, but AMHP is willing to take that work on. So I have 2 calls of action for you. Number 1, learn about the work of AMHP from their website, talk to board members, and use this information to be the catalyst of change in your community. Number 2, funding is so necessary for this work. As our family has donated to AMHP for the last 3 years, we ask you to be strategic with your giving. When you commit to a 3-year gift to AMHP, it helps you learn about the organization and watch its growth, but it also helps this organization budget and resource for the next 3 years. So I ask you to invest for 3 years in this investment to understand about mental health. Thank you from the Rise family, and let's not just survive as a Muslim community, let's thrive as a Muslim community. Assalamu alaikum.
Okay, so with that, that was like the ending for our presentation, but we'll open it up for any questions that you may have. I see some coming from the audience.